the tablets and so on are switched off as well, and just remind members to declare any interest, financial or otherwise, just as we move through today's briefing. Apologies have been received from Danny Kinahan, Nelson McCausland and Jonathan Craig. Moving then through to Chair's business, just refer you to table correspondence which has been received in relation to payment of pay increases to Education Authority employees. If members are content that we seek clarification from the Education Authority, so if you're content that we write to Gavin Boyd with regards to that. Okay. Also then with regards to the budget, the committee wrote to the department and the Minister on the 5th of March just seeking information on the Primary Modern Languages Programme and other matters which were relating to the budget. We wrote again on the 27th of March with regards to the Languages Programme. A response to this correspondence has been tabled, as has a letter which has been received by all members of the committee from the group of teachers. So if you're content that we note the correspondence and also then forward the group the response that we've received from DE just for their information. I'm not sure if anyone wants to make comment as to what further we can do with regards to this issue. Obviously I'd raised it at the statement for NSMC yesterday, and the Minister was quite clear that there were a number of schools who had quite significant surpluses, and he felt that obviously that this could be paid for out of those surpluses, but I'm not sure whether members want to make comment on that. Mr. Lunn.
Yes, the Minister made that comment. He didn't quantify how many schools he was talking about, and he may have used the word couple, I can't remember, but yeah, maybe he makes a fair point about a very small number of schools. To me, I don't believe that they're all operating in such a surplus fashion that they can afford to fund this themselves. I think it's just completely short-sighted and one of his worst decisions since he came to office.
Well, if you're content that we could maybe just on the back of what he said at the during the statement yesterday in response to that question, just to seek clarification, because I mean he made that comment, as you say, it was for 2 schools, but we could ask how that applies across and whether that's the case for all the schools which are going to be affected.
And I think also, Chair, to fund that in house, I suppose, in schools, is the Minister expecting the ability to teach the languages to be already in the schools, or because most often they're not, so they will obviously have to
You're buying it in.
Have to buy that in, is right. So that's a big issue.
If we can just if you're happy enough then that we pursue that further, Mr. Rogers.
It's really the similar point in that if a number of weeks ago we asked for further clarification in terms of where was this other possible funding come from in terms of supporting primary languages programme, and in that statement yesterday it talked about officials from the department and officials from the Department of the South were going away together to look at the Erasmus Plus scheme and going to report back to the next meeting of the joint group, which is in October. So there's going to be those teachers have lost their jobs now from the 1st of April, and the children have lost that experience. So we're talking about a massive gap here. That instead of having someone up there in terms of continuity, in terms of promoting the languages, it's not there. So it's a big worry that this another great initiative could be lost again.
Just on further to that, have we received any more information with regards to Book Trust?
I don't think we have. It's just there's some information that's come in through about the budget as we were discussing it today, Chair. I couldn't actually find reference to Book Trust in it, and maybe I've just not looked carefully enough. But
if the committee are content, then maybe we could write to the Minister again just with regards to Book Trust. Sorry, Mr. Sheehan.
Thanks, Chair. I just think that this issue about languages in primary schools, while it's commendable that, we think it's good that languages should be taught, there's no evidence that it's really having any great degree of success. In fact, if you look at post-primary, fewer and fewer students are taking modern languages at GCSE and A level. I have a wee bit of experience about kids learning languages myself, because my 15-year-old son is bilingual and my 3-year-old daughter is trilingual, and I've done a wee bit of research around this myself, particularly in around countries in Europe where there is a high degree of bilingualism, and it's particularly in Northern Europe. It's different in France, it's different in Spain. Spanish are a bit like the English. I think everybody in the world can speak Spanish, just as the English speakers think as well. And in terms of learning languages, in terms of kids learning languages, the best time to start learning languages is from birth. And if kids start learning another language at birth, they use a part of their brain to learn that language that stays with them for the rest of their life. If they start learning later, it's a different part of their brain that's used. The reason why Northern European countries are so successful in teaching languages is because they're exposed, and it's particularly in learning English, they're exposed to a lot of English language TV programs, English language films, and all of that. And there's a great deal of exposure, and it's similar, as far as I'm aware, in Poland. So, you know, it may be good to say, let's teach kids language. Maybe there wasn't a lot of research done into it to begin with. And I don't think we should be getting overly exercised about it. I think if we are seriously concerned about teaching kids languages, we should be developing a strategy for it, which involves a hell of a lot more than teaching kids an hour or two in primary school during the week. So.
Mr. Rogers?
I agree with Pat in terms of we need that strategy, but there's a lot of good examples of good practice coming out of these experiences there are in school, and you need sort of a baseline in terms of to develop that strategy. And I'd agree, you know, from birth is the right place, but the primary school child has a far more inquiring mind and is far more open and far more creative brain to language development than in post-primary. So, you know, it's trying to get the balance right in terms of the good practice that is going on there and building that into a strategy. And that's my fear, is that, you know, there's going to be a gap now, maybe of anything up to 18 months or 2 years, whereas if the good work that's going on and that strategy evolving out of that, that's what I would like.
Okay, Mr. Lunn?
Yeah, I don't disagree particularly with what Pat says about the ideal way to learn a second language. And, you know, from birth is probably the optimum, the most efficient way to do it, but that doesn't really happen in this country, and the next best way to do it is surely at early primary school. There's loads of evidence from across the world about the benefits of learning a second language, whether not just in terms of having a second language, but in the way it broadens your mind and your experiences. And you know, I have a daughter who studied 3 languages at university. I think she wishes she had studied them at primary level, because in those days it didn't happen. The department can't have it two ways, Chair. If this was a good idea 6 or 7 years ago when it was introduced, it hasn't suddenly become a bad idea now. And this is entirely about funding, and it's not very much funding. The principle hasn't changed, and the evidence hasn't changed.
Well, perhaps then, just with regards to that correspondence, I'm sorry, Mr. Hazard.
It's just a connected point, and to take many of the points on board, as has been saying here today, and sympathy with most of them. There's a wee connected point here, and I think the Minister referred to it actually, about the amount of money that schools are sitting on. I know it's been alluded to today that, you know, we're not talking about every school that's involved here, but some, and it's something in the region of about £40 million. That's public funds that should be used. Like, imagine what that £40 million would do for primary school languages across the board. I don't know if there's a piece of work that this committee needs to do, or perhaps follow up with the Minister to find out what he's doing to get that £40 million back into the system. So the schools, and he said it in the previous day, his schools use the excuse sometimes that they were sitting on this money for a rainy day. Well, he's saying that at the minute it's pouring, like, so let's get using this money. And I agree entirely. I don't know if there's a piece of work we can do specifically on our own around this, but certainly I would like to follow up with the Minister to find out, what's he doing to get this 44, I think it was 44 million he referenced, back into the system, so we can maybe look at some of the projects that have unfortunately been reduced in recent weeks.
Okay, so just with regards to the language programme, first of all, if in the correspondence we write to him citing concern about the gap that there's likely to be just with regards to paying off teachers before actually any sort of final decision is made with regards to exploring other funding streams, and also the developing of capacity within schools and so on, even if they wish to do it in-house. So sort of cite that as a concern, but also ask maybe around whether there is any strategy for learning a second language, as Mr. Sheehan has talked around, whether or not any research has been carried out by the department around that. I think maybe secondly, and maybe not to confuse the issues, maybe just to do it as a separate letter around school surpluses, because I know that I had raised that in the chamber with the Minister around the 47 million that he talked around, and how that is going to be utilised. There obviously might be concerns about that there could be a run on the money, so that might cause a problem in itself as well. But certainly there is a surplus there, held by many schools, and perhaps that's part of their three-year plan. But again, I suppose we need to get some clarification from the department as to what they wish to do with schools who find themselves in that position.
Sorry, Chair, just as an added aspect, be interesting to know. We talk about the whole skills agenda and connecting businesses with government, with schools, and enabling our young people coming through to have the right abilities, to get the jobs in the right areas. And we live in a very small world now, so that language is very much part of what should be an overall strategy on bringing our young people through. So maybe that's just an aspect you want to add into that letter as well.
Which of course then can lead us on to maybe the reduction in the Sentinels money then too.
That's right.
And the challenges that there are in delivering STEM and the gap, the skills gap that's there too. So I suppose there are competing priorities in all of this, but at the same time, as a committee, we're very anxious around the gap that there is for delivery of STEM, and yet there's quite a considerable amount of their budget that's been slashed. So okay, so content to be right to the Minister on those two issues?
Yes,
The
thanks.
right book trust.
And right to DE in relation to Book Trust. Tend to do that. Very much. I think that's us then. Delivering social change, yes. Literacy and numeracy signature project. Yesterday, again at the NSMC statement, my colleague Gregory Campbell raised the issue around the literacy and numeracy programme and delivering social change, and the Minister had said that obviously this fell within OFMD-FM, and there was consideration being given to looking at the programme again, and obviously the merits around that. I was wondering whether members would be content that we write to First and Deputy First Minister just giving support for that project and to encourage it to be extended, because obviously we're seeing positive results from that, and just as a letter of encouragement, I suppose, from the committee, if you're content to do that. Mr. Newton.
It's just your last few words there, Chair, in terms of the positive outcomes of that. I'm not sure that I know I did ask for those in a particular project in the east of the city I'm involved in. I just wondered if we could perhaps try to understand what the positive aspects have been of that investment and what the potential might be on a downturn of that to turn it into if the project doesn't continue.
I think, Chair, the signature project in question is to be reviewed by ETI. As the members are aware, the signature project in numeracy and literacy
So I didn't want to sort of wait until a full-blown, but there is anecdotal evidence, Chair, of that. And that would be maybe useful to us.
Will we want to refer that to the department?
Seeking their initial feedback on the.
Yeah, I mean, I raised the question with BELB as was, and they came back indicating to me, here's what the investment has been, here's the schools have been involved, here's what the principals are saying, that sort of stuff.
So we're looking for that from the
Well,
department.
we could write to the department just asking for that information.
Okay.
I would imagine that information then has been forwarded on to FMDFM if they're doing a piece of work in relation to looking to extend the programme. So, I suppose really the next comment I want to make is in around our visit to Limavady. 3 members attended the meeting on the 25th of March, hence there are no minutes of that meeting because the meeting was in Corrit. I have to say that it was incredibly disappointing, apart from incredibly embarrassing, given the fact that both schools which we were visiting had gone to a huge amount of effort to host us. I don't really want to say an awful lot more than that because I am really disappointed with the fact that we weren't able to hold the meeting that day. But I would like to write to both schools in question, that's Limavady High School and St Mary's, to thank them for their hospitality because they really did go out of their way to make us most welcome, and to apologise for the meeting not going ahead as planned. So I'm not sure what Mr Lunn and Mrs Overend were also in attendance. I'm not sure whether Mr Lunn wants to make comment on that.
Well, I would agree with what you've suggested, Chair. I think it has implications for further visits away from here as we plan them, but we need to get a fairly firm commitment from members that they're able to attend. It was totally embarrassing. When you get down to 3, as you say, you can't even have a formal meeting. I know the discussion we had was actually pretty useful, but we were able to involve the head teachers and so on, and that was pretty good. But the schools have gone to such a lot of trouble. Just seemed a pity.
Okay, thank you. So moving then to draft minutes of the meeting which we had on the 24th of March at page 46. So if members are content that they are a complete and accurate record of those proceedings, or if you're content. Okay, thank you. Moving then to matters arising, just refer you to Clerk's cover note at page 53 with regards to the anti-bullying consultation and to the relevant departmental papers which are appended. If you're content that we forward the response to the department in this instance. Okay. 5.2, we have SR 2015-170, Teachers' Pensions Consequential Provisions Regulations Northern Ireland 2015, just refer you to the statutory rule. The committee previously agreed that it was content for the rule to be affirmed. The Assembly affirmed the rule on the 16th of March 2015, and the final version of the rule is appended for members' information. So if you're content to note that version of the rule. We have then 5.3, investigating links in achievement and deprivation. That's at page 179 of your papers. As agreed, the clerk attended the presentation on Tuesday the 31st of March. This report's been funded by OFM-DFM and is to be issued in April. There are slides and so on which have been appended just for your information. If members are content that we will maybe look at this again whenever we receive feedback from Dr. Ian Shuttleworth on free school meals entitlement. This is scheduled for the 20th of May, but may be subject to change, obviously, given the department's indication that they may come that day to discuss shared education. But if you're content that we look at that again, just along with that report. Special Educational Needs and Disability Bill, just refer you to tabled items which include the Equality Screening Document and Delegated Powers Memorandum. If you're content, we can publish the submissions on our website, on our webpage, sorry, and to forward the delegated powers memorandum to the Examiner of Statutory Rules just for his consideration. We're content that we do that. If we move then to our briefing, first briefing, which is in regard to retention and disposal schedule, Department of Education employee records. I'll refer you to Clark's cover note at page 196, and also then to the relevant papers, which include a copy of the DE employee record retention and disposal schedule and relevant recent correspondence. And we welcome the following departmental witnesses. We have Michael McGivern, who is the Departmental Information Manager, and Willie Elliott, who is the Departmental Information Officer. Gentlemen, you're both very welcome to committee this morning, and if you'd like to make an opening statement, and then members will follow up with some questions.
Well, basically, our opening statement would be the letter that was sent from Medallo to the clerk, to the schedule for...
If you'd just like to talk us through that.
Yeah. Well, the schedules were prepared by the Northern Ireland Civil Service Working Group, which was established by the Information Management Council to examine the issue as a result of an Information Commissioner's Office declaration following an audit of HR Connect. They had a 72-year blanket approach to personal records that wasn't sustainable. The idea behind the schedule was to ensure that the civil service took a corporate line regarding personal records, so that a consistent approach could be taken to retention and disposal of human resource records on HR Connect as well as in the department's personnel records. In this instance, refer, for example, to data such as pension pay, career history, individuals' personal medical records relating to treatment or diagnosis, which would be held elsewhere, for example, in GP surgeries, hospitals and coroner's offices. So, the minimum retention period for medical records of those exposed to a substance hazard to health 40 to 50 years, 40 for and 50 for radiation, as per legislation. This is counted from the date of the last entry or record on the file. It would be unlikely, for the nature of those records, that the last paper would probably be at death or pensionable age, so the 40-50 year period would then begin. As well as, because we have a retention period, doesn't mean that the record is automatically destroyed without consideration. We'd be looking at that. These records, like all records, would be assessed for suitability for disposal at the end of the retention period. The Northern Ireland Civil Service approach has been taken, the advice of the National Archives and endorsed by Prony. Not much else really I can say.
Obviously the concern that the committee had was the fact that other records were being kept considerably longer than the medical records, and obviously the timescale for asbestosis and so on can take quite a considerable length of time to show signs of being in someone's system after they've left the employment. I suppose that was the primary concern from the committee, that you were disposing of these records, yet there were others which maybe didn't seem to be just as important, were being kept for much longer.
But that isn't in reality, that isn't the case. You know, as I'm saying, at the age of 100, but these records, the last record would be, as I said, at death or pensionable age, and then for 40 years after that, which is likely to be 100 years or more anyway.
Okay.
This is, you know, advice been given by the National Archives.
Yeah, I'll bring Mr. Lunn in, obviously.
Yeah.
Particularly concerned around this issue.
What you mean is my fault that you're here. It's the same argument, you know. Well, it's not really an argument.
Yeah.
It did seem strange that certain things, such as a copy of a decree absolute, should be kept until the person would have been 100 years, whereas this very serious medical condition record had this, you know, 40 years from the last entry. If the last entry was pensionable age or age of leaving service. That could well be in the same area as 100 years of age. But you know, I was thinking, what about somebody who left the particular employment at age 30, but not to something else, and then the disease developed in later life, as is frequently the case, and there's still shipyard cases coming forward, you know.
Yeah.
And that was the query, you know, that just the contrast. Now we've since discovered that you're following guidelines. All the other departments are following the same guidelines and so on. But some of these things did seem contradictory.
It just in relation to the particular query of someone leaving at 30 years, there would be medical records in relation to referral to the OHS or whatever, and they would be still kept. The person's 100 just because they've left at 30 or 40 or left the service.
Yeah.
This wouldn't indicate that they would be disposed any sooner, and therefore they would still retain for the period until the person reaches age 100, irrespective of what year they left the service.
That would be related to industrial injury on the list, not right? Sorry, I'm just looking at the list here. I'm sorry to interrupt
Yes.
you, but there's two categories there. One of them is medical certificates unrelated to industrial injury, and the other one is related to industrial injury. One of them is 4 years from the end of the period, and the other one's age 100.
Yeah.
But that's the kind of
Yeah.
query, you know.
This, of course, wouldn't be records held by GPs and that sort of thing. This would be strictly on the employee records, and their pension details would normally be kept probably for as long as that. And of course, these are civil servants within the Department of Education, and would not include public servants as the teaching profession or in the wider education sector. But again, as I say, the legislation in terms of the asbestosis at work regulations stipulates 40 years, which is a trigger. But that, of course, is only at least to be kept for that period. Currently, as practice, when we would reach a disposal period, we would check again if there was any ongoing actions, any particular investigations going on. We would extend that retention period for as long as necessary. There would not ever be a case of automatic destruction. It's a minimum period that's set.
Yeah.
And we would check with relevant business areas within the department that this has come up for disposal, and we would seek the reassurance was it still appropriate to destroy. So we would want to reassure the member that there would be no hasty action to dispose of records like that. This is only a minimum period that would be set, but we're entitled under the Retention Disposal Act to retain for a period longer if required. And of course, if symptoms of this illness presented itself at a later stage, then clearly the action or last papers are likely to be whenever the illness takes place, and either the person sadly dies or recovers. Therefore, the 40 years only kicks in from that point onwards.
Have there been cases, I'm looking at lead or asbestos probably, have there been any cases involving the education employee system?
No.
None at the moment. I've checked this with the health and safety officer. We have no current records of anyone have been exposed or reported to have been exposed. So we actually have no records at this moment in time.
There would have been a more relaxed attitude to lead and asbestos in the past than what there is now, you know.
Well, I mean, my understanding is that the control of asbestos and the management of it is something done centrally from the Department of Finance personnel, and who has obviously control over the buildings within where public servants are employed. So that would be, I think, managed in strict accordance with health and safety rules. But the likelihood of staff being exposed it's the impression I got was minimal compared to perhaps people who would come on site who would be in the industrial sector perhaps, or involved in repairs that might be working with materials. So, as I said, at this stage we have no known incident or investigation going on.
Their claim, if they had to make one, would be against their own employer, wouldn't it, rather than the
Yes,
school?
yes, someone outside the civil service,
Okay,
yeah.
look, that's okay. I'm happy enough.
You've obviously asked us not to move the motion. What challenge would it present you if we were to continue with the motion?
Well, we would probably be concerned that obviously it is a corporate initiative, and it has implications for all the other departments who would be anxious that we would proceed as one body, because it obviously would be less costly implementing this schedule in terms of applying it to all civil servants throughout the Northern Ireland Civil Service, and for this department to go it alone could possibly incur a cost, although I don't know if it would be substantial. At this point, we don't know the Minister's view, but we'd obviously want to point out that there is a recommended minimum period within the legislation itself, the asbestos, which is separate, saying the 40 years. So, we would have to draw that to his attention.
Yeah.
Thank you. Do members have any other questions? No? Okay. Well, thank you very much. Thank you.
Thank you.
Okay, thanks.
Okay, members, just want to get your thoughts as to whether or not you feel reassured by the department's undertakings in relation to this, and whether or not we move the motion.
I'm on the basis that what they've offered about the review by next year, I'm happy enough not to move the motion, if you want to take that as a suggestion.
Other members given any consideration to this? Content that we don't move? Content?
Yeah.
Very good. So, Chair, as Chair, you'll then write to the Speaker indicating the details of the decision. I'll draft that, and then on the day, you get to go along to the Assembly and just say not moved, so members know what will happen. So it'll still be in the order paper.
Okay. Okay. So that'll save you having to write something for that.
Thanks for that.
Okay. Moving then to our written briefing, which is with regard to SL1 General Teaching Council appointments. Refer you to Clerk's note at page 216, and refer you to the SL1, the General Teaching Council for Northern Ireland Constitution Amendment Regulations, Northern Ireland 2015. Really, the draft rule just makes one change, which it removes the Association of Educational Library Boards as the nominee for the Council for GTCNI, and replaces it with the Education Authority. So it just brings everything into line as to where we are now. So are members content with that?
Yep.
Okay, so I'll just put the question that the Committee for Education has considered the SL1, the General Teaching Council for Northern Ireland Constitution Amendment Regulations, Northern Ireland 2015, and is content for the proposed rule to be laid. Agreed?
Agreed. Yep.
Thank you very much. Moving then to our next briefing, which is from the Ulster University Vision Science Research Group. And I refer you again to the Clerk's cover note at page 221, and also to the briefing from the Ulster University, a briefing paper from Michael Gilsonan of Titian, considered in April 2014, and a draft summary from the committee's recent informal evidence gathering event on health services, which provide access to the curriculum. Can I welcome Professor Catherine Saunders and Dr. Sarah McCulloch? You're both very welcome to committee this morning. Can I ask you to make your opening statement, and members will then ask you some questions?
Okay, thank you very much, and thank you very much for providing this opportunity for us to come and speak with you. Sarah and I are both optometrists by training, but we're also researchers and academics based at Ulster University. And instead of bringing you up to meet with some of our research participants, as was the plan, we thought instead we would bring some photographs of some of the people who participate in our research and our clinical work, just to bring some context to what we're talking about this morning. We've got some information on the briefing paper. We're also going to just try and cover some of those points, in particular in relation to education and how that interacts with vision, which is our speciality, education being your speciality, in the next few moments.
So you may remember last year Mr. Michael Gilson presented some work to you. He's an optician from Warrenpoint, presented some work about a pilot study he'd carried out in a school in County Down, looking at their vision in some of the children. And the results had raised some concern about whether the current school vision screening was failing children in mainstream education, that it was missing some visual problems that may impact on their education. Some of our current research is looking at the current policies of school vision screening. And one of the points that was raised by the committee at the last time was that they would like more information on the protocols of what happens with school vision screening. This is a picture of Hannah, and she's taken part in some of our research with the school vision screening study. And as you can see from the picture, she's having her eyes examined. So school vision screening looks at distance vision, and each eye is measured in turn. The current school vision screening is a comprehensive service across Northern Ireland, and it follows the protocols that are set by the UK National Screening Committee guidance. It occurs in the first year of formal education, so it occurs when the children are 4 to 5 years of age, and it is aimed to look at reduced vision, and this can identify lazy eyes, eye turns, and also some children who may need glasses. Our results, we have also conducted a large-scale study of vision and the need for glasses in children in Northern Ireland, in school children. And our results have shown that there is very little gross visual impairment in children in the schools in Northern Ireland. In children at the age of 6 to 7 years, we actually found only or less than 2% of the children had a significant visual impairment. So we would suggest that the current school vision screening programme is actually serving these children quite well. There are a few things we would like to talk about the vision screening and how there may be a few areas that it could be improved. It's only measured once at 4 to 5 years, and children do change as they grow, and their need for glasses does change as they grow as well. So some of the children that pass school vision screening may end up needing glasses in primary or post-primary years. The other important thing is that it only measures distance vision, so high contrast, so black on white letters, distance vision. And we all know from being involved in education that most of schooling and learning is at near vision, so there's no measurement of near vision in current school vision screening.
Okay. The next photograph is a boy called Emmett, who also takes part in the research that we conduct at the university. Now, Emmett, like Hannah, had his vision screening at age 4. He passed vision screening because his vision is good in the distance and he was able to pass the test. But he does have a significant visual problem. In P1 and P2, his parents were concerned about his progress in learning to read, and they brought him into the clinic to have a full eye examination, where we were able to discover that he was significantly long-sighted in both eyes. And whilst his vision was good at distance and at near, he was working much harder than his peers to see clearly at near and to concentrate on his educational material. So we were able to prescribe glasses for him, it improved his reading performance, and he's essentially doing very well. The reason this is relevant in Northern Ireland is there's a lot of children in Northern Ireland who are long-sighted. We have much higher prevalence of long-sightedness in Northern Ireland than in other countries. So if we compare teenagers in Northern Ireland to teenagers in Sydney, Australia, using the same techniques and the same criteria, we have about 5 times more long-sightedness here than they do in Sydney, Australia. And we've been doing some collaborative work with colleagues in Australia to look at this. The other thing that's really important about long-sightedness, and this is data that we're just starting to analyse at the moment, so these are very hot off the press results, is that long-sighted children like Emmett are significantly more likely to fail at GCSE Maths and English than their contemporaries. This is a finding that's never been looked at before, never been reported before, and we're really interested to take this further and look at it in more detail. And it ties in with Mr. Gilson's concerns about subtle visual deficits. We didn't look at subtle visual deficits in the study that we performed in the NICER study. We were looking at the more traditional types of visual deficits that you find in a normal eye examination. However, we suspect that long-sighted children like Emmett are more at risk for visual stress and the subtle visual deficits that Mr. Gilson talked about, because long-sightedness puts stress on the visual system. And currently the situation is a little bit unclear. Could we do more for Emmett, not just by giving him glasses, which cover the overt kind of obvious visual problems, but if we'd looked for subtle visual deficits, would we have found them? And if we treated them, would he do even better with his reading and his academic performance? And we just don't know that at the moment. And we would join Mr. Gilson in calling for some robust research to evaluate whether there are these associations between subtle visual problems and underachievement in academic circles.
So in addition to looking at typically developing children, we have a strong research and clinical interest in children with special needs and how they see. We have done a great deal of research in looking at how children with Down syndrome see, like Holly. And you can see from the picture, Holly wears glasses to help her see. She also, in addition to standard glasses, you may be able to see that she wears bifocals as well. And this is to help her focus up close. And I'm sure some of you in the room, maybe here over the age of 40, know how difficult it is to focus up close without the help of your reading glasses or your varifocals. And this is similar to what Holly has in terms of her sight. You can imagine that because quite a lot of educational material is at near, she's having difficulty seeing up close. Some of the information that's being presented to her at school, she's missing out on before she got her bifocals. These children then, it tends to get worse as children move through the educational system because print size gets smaller and there's much more information on the page. So although Holly had very good language skills, as she was going through school, she had much more difficulty with neat writing, keeping between the lines, and maybe successfully completing some of her work that was set for her. And often in children with learning disabilities, this is put down to the learning disability rather than looking for other problems that might be sight. So once Holly got her bifocals, in her own words, she said that my new glasses make my work easy. So it is vital that these children receive full eye examinations by eye professionals that are both proactive and up to date with the problems that these children have and know how to treat them as well. This is not always the case for children like Holly. There have been 2 studies recently in London and Wales that have shown that approximately 1/3 of children in special schools have no history of having an eye examination. A study that we're hoping to carry out now, commencing October, will hopefully find this data out for Northern Ireland as well.
The next photograph is of a little boy called Alex, who has a more severe learning disability than Holly. He also has a physical disability, and as you can see, he has difficulty controlling his eye movements. Maybe from that photograph, you can see his eyes aren't quite pointing in the same direction as each other. Due to his underlying disability, he's also got damage to his brain, which has affected the way he processes vision and the way he sees. So he has a significant visual problem, but assessing his vision is quite challenging. Whereas for Holly, it might be totally appropriate for her to go to her local optometrist on the high street and be tested in that kind of environment. For someone like Alex and his peers, a hospital assessment with specialist eye care professionals is probably more relevant and more appropriate. The hospital eye service, though, is challenging for Alex because it's an unfamiliar situation, it's an unfamiliar environment, and he can't always access his best behaviour in those situations. He can find them quite threatening and difficult. And it can also be difficult and challenging for his parents. They have a lot of appointments to take Alex to, and taking another appointment, taking time off work to take him to the hospital can also be difficult. So we propose, and several other people have proposed this as well, that children in special educational environments should receive their vision care within the school environment. We think this would be beneficial for Alex because it would be familiar for him. And we think it would be beneficial for his parents so that they didn't have to attend. But personally, I think one of the main impacts, the main benefits of this would be that it would integrate vision into the school and educational environment. Because our work with parents and with educators and with other key stakeholders tell us that they're often unsure about vision. A child may be receiving good, regular eye care, but often that visual information is locked into the hospital files. The optometrist has a great deal of information about how that child is seeing, but the parents don't feel that they are empowered and know that information, and the teachers feel the same. So that Alex's underlying disability may be compounded by a visual impairment that's poorly understood. We also know from research that we've done by looking in the Statement of Educational Needs, or the Education, Health and Care Plans, as they're sometimes called, these documents rarely articulate properly the visual support that's needed for many of the children that are in special education. And if that information is not in those important documents, then visual care and visual support won't be able to be provided appropriately for these children. And it's vital that people working with Alex know what he can see and what he can't see. If he's being asked to engage with educational material, it needs to be the right size for his visual limitations. It needs to be placed in the right place. His eyes need time to find it, which is not the case for you or I. We move our eyes very quickly and easily. He needs to be given time to find what it is you want him to see and learn about. And he also needs to we need to make sure it's not better to present things on one side or the other, because a lot of children with special needs have difficulty seeing better on one side than the other. So all that information needs to be embedded in his education. And we've been working with stakeholders, including eye care professionals in Northern Ireland and across the UK and Ireland, to encourage better communication of this kind of visual information to parents and teachers. And it needs to be meaningful, and it needs to be non-jargon. And our research has shown that where that is the case, it's valued and it's used by parents on a daily basis, and it benefits the child. And as Sarah was saying, we're hoping to start a big piece of research. It's not an insignificant amount of work, and we're hoping to get some funding to do it, to look at the situation in Northern Ireland with regard to whether or not it would be effective to provide in-school vision care for these children, and reports that are meaningful for parents and teachers. We want to see whether, if you do that, you reduce visual need, you improve visual health, and you improve the stakeholders' understanding of vision in these kids. There's talk at the moment about introducing such services. I don't know currently whether they would be effective, and we would really call strongly for there to be a good evidence base, and for services to be developed in an evidence-based way rather than in an ad hoc way. And we're interested in doing that research in collaboration with colleagues in Cardiff and also in London. So thank you. I think we've probably gone a little bit over our 10 minutes, but thanks for giving us this opportunity. I'm hoping you have some questions, and they may stretch beyond the sort of things that we've talked about. But can I just really encourage you in the important work that you do. You get a chance to meet a lot more influential and important people than we do. We're stuck in the university doing our teaching and our research, and this is a great opportunity for us to tell you to consider vision, and particularly in the education environment for those children with special needs, how important it is. And just because someone has two eyes and they're pointing in the same direction and they don't wear glasses doesn't necessarily mean they don't have visual needs, and they're not necessarily being catered for.
Okay, well, thank you very much. That was really very interesting. So, and thank you for sharing that with us. What do you think? What can this committee do in order to help you with the work that you're undertaking?
I suppose really it's just that point, just to have that in your head. We engage with the education authorities when we're undertaking research, because most of the research we do is in schools, so we tell them about the research we're doing in order to make sure that they understand we've got ethical permissions and so on. But apart from that, we don't have very close relationships with the department or the Department of Education or the Education Authority. But you are connecting with those people, and I guess we would just like to make sure that you think about vision, and also if you have questions that you think might relate to vision, we're more than happy for you to contact us and say, what do you think about this, or do we need to have better evidence before we start employing this policy in a widespread way in Northern Ireland? Is there other evidence, even from other research groups, not just our research group, that could help inform the way we do things?
The comments that you made around children who are alongside was actually was interesting, and that statistic that 5 times more likely to have a child in Northern Ireland who is alongside compared to Australia. Do you know why that is the case?
It's probably genetic. So we have a relatively small gene pool in Northern Ireland, and traditionally it's been quite static. And your prescription, your long-sightedness has got a heavy inherited component to that. So I'm long-sighted, my 3 children are all long-sighted, my husband's long-sighted. You know, there's no hope of us developing short-sightedness in our family. And short-sightedness is where most of the research has been done. There hasn't been a huge amount of research done on long-sighted children, and that's why these results are so interesting to us. And we actually need to look at them in more detail. Sarah's currently conducting the analysis of those data, looking at the GCSE results to look at whether or not at the moment it's an association, but is there, and we're not saying that being long-sighted causes you to fail your exams, but there's an association between the two. And it could be that the other factors that make you long-sighted, like your hereditary, like the environment that you live in, are also contributing to those poor examination results. So there's more work to be done on long-sightedness in general, but in particular in Northern Ireland, and in particular in relation to education.
And do you think that it'd be useful to look at other practices for screening, sort of focusing directly on that cohort?
Well, currently we're looking at how the current vision screening is actually its ability to detect children who need glasses and who need long glasses for long-sightedness. And what we've been doing is doing the current screening policy and following exactly the same guidelines as they would suggest, and also adding in other different techniques that would maybe be more helpful at picking up children who have long-sightedness. But we have found that hasn't really worked in the age group that we have, because the children are young, they're 4 and 5 years old. It is a little bit more difficult to detect with the procedures that we had suggested.
So I don't think we would suggest that vision screening needs to be changed. It does what it says it's supposed to do. It identifies reduced vision for most children, and it is a screening test. But I think there might be some work that we should be doing in relation to public health and the awareness that if you are someone who was long-sighted, or if you had glasses from a young age, or as you've got older you've needed to have glasses for reading and so on, before the age of about 40, you might be long-sighted. And maybe you need to think about getting your child into the optometrist to have a full eye examination. So I think there's work around the public health, the understanding of vision and visual development that needs to be done.
And it's very much then about parental awareness then as well.
Yeah, I think so, because I think screening for long-sightedness is not necessarily, would not necessarily prove useful. There's been a lot of work last year and the year before the national screening guidelines were reviewed, and so they looked at all the evidence about how you could change it, what different things you could add in, and we've also been contributing to that with the research that we're doing. But actually, just to identify reduced vision, I think it does a good job. It does what it says it's going to do. We have a particular problem with long-sightedness here, but I think that might be around raising awareness of the importance of eye examinations, particularly for children who maybe aren't progressing as fast as you'd expect at school, those kind of areas. So maybe with teachers too.
Mm-hmm. I had an interesting conversation yesterday with a parent whose child has dyspraxia,
right,
but has very good vision. But yet the test was able to show that there were issues, I suppose, really high
coordination
in the coordination and how I suppose his brain was telling his eyes what to see, I suppose, in some ways, or what to look for. And she was able to present a graph which she'd got from the test, which showed a real difference between what I suppose would be expected of a child who didn't have dyspraxia and her son.
And it's all those kind of bits of non-traditional eye examination that I think Mr. Gilsinnan was talking about, and he's very interested in that, and we need more research on it. It's always been a bit of a Cinderella subject. It's been a little bit to the side of mainstream optometry and mainstream eye care, and I think there's a lot more interest now and a lot more anecdotal data that would suggest we need some good robust studies that really explore that in more detail, because as you say, that child maybe is managing okay, and she would pass, or he would pass, this vision screening test, and it's only if they did a non-NHS funded type of sight examination that they would find out those additional things. So our standard NHS eye test wouldn't expect to look for those kind of deficits. So it's quite special.
I think as well, just we were talking about raising awareness, just to make sure that there's an awareness with parents and teachers that if they pass the school vision screening, that it's not that they have no visual problems at all. You know, that some children, like the children with long sightedness, can slip through the visual screening, but it's just to make sure that the parents are aware that there could be problems maybe develop later on in life, and just to raise the awareness that that's not the end point, that they're not fine for the rest of their days, to maybe to encourage more eye examinations.
And we've also got lots and lots of short-sighted children in Northern Ireland, again, more than Sydney, Australia. So I think it's 3 times the number of children in Northern Ireland are short-sighted, which is the opposite of long-sightedness. And although that probably doesn't have the same impact on education, because you get good clear vision at near for your books, it is something that comes on in the later primary years and post-primary education. So it's never going to be detected in vision screening unless you're starting very, very young, which is unusual. And parents need to know that, you know, they should ask their children, can you see the leaves on the tree? Because I know several people who've, you know, they've got their first pair of glasses aged 12, and they've probably been quite short-sighted for quite some time, and they're like, I didn't realise you were able to see the actual leaves on a tree. You know, they knew it was a tree and they were able to talk about it. It didn't impede their life at all, really, but they were missing out on some fun.
Yeah, I'm long-sighted, and I was 11. I got my first pair of glasses, and still colleagues would be surprised if I managed to find the glasses at the bottom of my bag. And I suppose it's really about, I'm very good about going to get my eyes tested, but not so good about using the glasses, which are...
But I think that is a problem in schools. Actually, one of the points in the briefing was that although we didn't find any evidence in Northern Ireland that children who needed glasses didn't have them, 1 in 4 of the children who did need glasses didn't regularly bring them to school, and they did have poorer vision as a result. So they were missing out on stuff. And it's, I suppose that's a social education thing, isn't it? It's about improving the acceptance of spectacle wear. And I actually think that is getting better. In my perspective as an optometrist is I see that the frames are nicer than they used to be, and children are a little bit more willing to look a bit different or wear something a little bit different. And Harry Potter apparently was very good for the interest amongst children in terms of wearing glasses.
Okay, thank you very much. Mr. Lunn.
Yeah, thanks for your presentation. It's very interesting. I could read Mr. Elliott's name on that table behind you there, but this is coming around a bit. Without. Are you saying that if I was a 3-year-old, that I would be automatically tested for that distance, but not for this?
Yes.
It seems to be almost back to front in the modern age, doesn't it?
Well, most small children, if they don't have a developmental disability like Down syndrome, even though they might see more easily at distance, they can use the muscles in their eyes to also see clearly at near. So we could test them at near, but they'd probably pass. It's when they're reading for 15 minutes, 20 minutes, or when they're tired and they're sitting at the end of the day trying to do their homeworks and their spellings, it's just harder work for them. So it's not that they can't necessarily see it, but we're making them work hard to do it. And obviously we want reading and engagement in education to be fun as much as possible for young children. So it's about removing the extra difficulty, removing the muscular effort. And they won't complain of problems probably, because to them it's totally normal. You know that it shouldn't look like that when you look at it, because you can make it nice and clear with your glasses, but they don't.
But are you saying that it's actually harder to establish whether a child has a problem close up?
You need to use tests which are more difficult to administer than the standard vision test, than the standard read down the chart test. And that would make it more expensive to do vision screening. It would mean you'd need more well-trained professionals. And actually it probably isn't cost effective. When people have looked at that, they would say adding those extra things and the extra professionals in would make it not cost effective. Again, it's about maybe the parents realising that the child is not engaging with homework, is not interested in reading, and thinking, do you know what, it's easier for me when I put my glasses on. Maybe I need to get wee Jimmy's eyes tested. I think there's an education message there.
Is there any evidence that either the printed word or the screen word that puts any extra strain on a child? Because there's clearly far more demand on them these days to be looking at these kind of things.
Probably visually it's not too different, although when you have lots of colours in the background, so you have a different colour background screen and maybe various different other colours in the text, that's slightly different visual demands for your eyes, so that can be a little bit more stressful for the eyes. one of the big problems with looking at screens for any length of time, and I'm sure any of you who use a computer without a pair of glasses for a significant length of time, is your eyes can get quite dry because you tend to blink a bit less. And the blinking helps keep your eyes moist and comfortable. So if you're doing a lot of screen work and you're not blinking enough, you're not taking breaks, your eyes can get a bit dry and itchy and sore. But it probably isn't really doing any great damage to eyes.
Yeah, so it's a bit of an old wives' tale in some ways, isn't it?
Well, there was always this association between children becoming short-sighted and doing too much near work and using tablets and screens and so on. People were getting very worried. There's been an epidemic of short-sightedness in East Asia, and there was a concern that this was because of all the studying and the very intense schooling that they have. But all the research that's done to try and evaluate whether that's the case ends up pointing to the fact that it's not that they're spending more time reading, it's that they're spending more time indoors. And there is a public health message which is starting to come out, and I think will come out from the results of our work as well to a certain extent, although we don't get fantastically sunny days, that the more time you spend outdoors, the better that is for fending off developing short-sightedness.
Yeah.
So there's whole schools in China now who are being given slightly different schedules. So instead of spending all day inside studying, they have to go outside for a certain percentage of the time, and even study in glass-roofed classrooms to try and prevent all these children becoming short-sighted. Because in China, it's sort of 80 to 90% of children, by the time they leave school, need glasses for short-sightedness. It's a massive problem for them, not so much for us here.
No, but that's pointing towards lifestyle.
Yeah,
being a
but maybe not
major
the
factor.
reading. Maybe it's just we need to be outside more, which would be a win-win situation because we could get the kids out playing, try and prevent the obesity issues. It's got to be good. Our children spend less time outdoors than they ever used to. And it would be good to get them out, but I guess people are nervous about letting their children get out and about too much these days.
Pretty sad, that, isn't it?
Yeah.
Thanks very much.
Okay.
Okay, thank you very much. Mrs. Overend.
Thank you, Chair, and thanks very much for your presentation. I found it very interesting. And in the Chair's raised some of the questions that I was thinking of asking you, but you'd said that if there was better research, you might be able to find out if there's something more that you could be doing for this child at school that's got long-sightedness. What more could be done to help?
I think a big study that has enough strength, enough research power in it to be able to say, is there a statistically significant association between these visual deficits and poor academic achievement? Because we have standardised tests for academic achievement and we have these standardised visual tests that we could use. But so far the research has all been done on very small numbers. And because every child is different, there's going to be lots of other factors that are going to influence their academic performance as well as their vision. So you need a significant body of children to go through such studies. So you might need to look at maybe at least 50. We did some calculations working with Mr. Gilson, and we felt that to get a robust sample, you need at least 50 children who had been shown to be failing academically or less than their potential, so their IQ would show that they should be achieving better reading and maths scores than they are. And then you'd need to get a cohort of children who are doing as well as expected academically and look at the visual deficits in the two groups and see if there's a difference. And if you find a difference, then you have to say, well, can we do anything about that difference? If you treat the deficits, that's another whole study. You'll need to do a double-blind, controlled, randomised trial to see whether or not treating those deficits is going to have an impact. But the first thing to do is see if there's a real association, or is it just anecdotal? Is it just because most of the studies are small and poorly controlled?
Well, is there more that can be done? More can be done to find the people that are long-sighted or short-sighted, but is there other things that can be done to support them once you find out what the condition is?
Yeah, I think we tend to work with our profession in terms of I think the long-sighted findings that are coming out just now from the NICER study, we'll be working with the optometric profession to say if you do find that you have a long-sighted child, be proactive about prescribing if they're struggling with learning to read, if they have academic underperformance issues. But until we know whether those interventions make any difference, it's very it's not correct of us to say you should try these things because we think they might work, because there's a cost there for the NHS, there's a cost for the parent, there's also, you're not doing it in an evidence-based way. So I suppose our feeling would always be that you need to establish the evidence first and then change practice. And that just hasn't been done for the visual stress issues, the subtle visual deficits issues. As I say, it's been a bit of a Cinderella topic. And until proper research is done, I think it always will be.
Thank you. I mean, you talked about the test being taking place in school in the first academic year, but then, you know, we can take our children to the optician for a free eye test.
Yep.
And,
Yep.
you know, I do that every year with my children. But how is that information reached, or how is it provided to parents so they know that, you know, so my youngest is 9 and I've been doing it since forever. Do you know, when I get the letter from the optician every year saying you're due for an eye test, but
once you make that first contact, it's good because you get the recall letter.
But how, I mean, there could be people then that aren't getting that information. How do you know how that information is getting through to parents to tell them they're entitled to a free eye test?
There is no policy to encourage parents, as far as I'm aware, to access eye examinations. So children have their 2-year health visitor assessment, and at that point questions are asked about any visual concerns, although there's no visual testing done, and then they get their P1 vision screening. And what we would like to see is that at the end of that, when they get their letter to say your child has passed vision screening, but this doesn't mean their eyesight's going to be perfect forever, and then there was some kind of comment within that document, within that letter that comes back to the parent that highlights that their child's entitled to a free NHS eye examination from an optometrist. At the moment, I don't think that is included in the summary information that's sent to parents, and I think that would be a good thing to include.
Then maybe that's something we could follow up with.
There is information in the Red Book that every child gets whenever they're born about if the parent have any concerns about having vision, you know, if the child has any vision problems, that they're able to attend for an eye examination. But it's actually much further down the list than any other problems. Like, they're much more encouraged to get dental care, as opposed to this very small section of the book. And by the time the child gets into primary school, probably the Red Book has been long gone and is not looked at for information. So a little bit more information, raising awareness of the fact that examinations are available on the NHS would be, to parents, you know, would be useful. And maybe some of this, we can get some of that help through get more awareness to teachers as well, and those who think that may be struggling at school.
Yeah, okay, thank you very much. Thanks.
Mr. Rogers.
Thank you, Chair, and you're very nice to see you again. We are here in terms of school vision screening. In terms of a full eye examination for our children is away here somewhere, and it's not really realistic. But from the work you have done, and certainly from the work Michael Gilson has done, there's quite a considerable group of children who are, and I may say every parent is not like Mrs. Overy and is taking them every year for their test, but there's a significant number of pupils or young people who are experiencing some sort of a visual stress or whatever. And once you experience that visual stress, it is affecting the child's ability to read, and if there's a problem with reading and literacy, it affects your whole education, affects the underachievement. So I think you've been in saying, you know, it's good raising the awareness, but I feel we need to do a lot more. The work of Michael Gilson was with one class of 27 children in Uri School, and it did show significantly that with a more detailed eye test and correcting some of the stress, it does affect achievement. So how do we get, you've mentioned the words, you've mentioned strong evidence base. We just haven't got a strong evidence base at the minute. But how do we get that strong evidence base? We need that robust research. So what we're really saying here today is that, what I'm saying is, how can this Education Committee influence so that we get another piece of research done, a bit like the Michael Gilson, but with a lot more children? So what do we need to do?
Well, I think you need to identify a source of funding, because it's not cheap to do that sort of research. It takes a lot of time to go through all the ethics to get into schools and provide those kind of research tests. And as I said before, you need a substantial body of participants within that research in order to be able to say really clear things. And I suppose it's also in the context of the profession, the eye care professions will be sceptical. So you need copper-bottomed research. It needs to be really strong and published by credible individuals in order for anyone within the established eye care professions to really take notice of it, because it has always been a little bit left field. Having said that, it's harder and harder to get funding for research unless you're going to cure cancer or you're going to do stem cell research. Children who are slightly underperforming in their reading, it's very important to that child. And I totally agree with you, but it's not necessarily sexy research. And it's harder and harder to get funding for research. It would take, I would say, between £70,000 and £100,000 to do a really good study and get it published in Northern Ireland on children, and to see whether or not there was that association between the subtle visual deficits and the underachievement academically. But where that money comes from, and we're always looking for different sources of funding. At the moment, most of our funding applications are centred on the children with special needs, because that tends to be a more available pot of funding, to be honest. But I do think if the Department of Education is keen to look into that problem more, they'll maybe need to stump up some funding.
Yeah, because I get from you and from speaking to you before, so you people are very much up for this research.
Yeah, we'd be up for doing it. And we do get funded from the Department of Employment and Learning, the Dell PhD studentships that happen. But they're becoming tighter and tighter. It's a difficult economic environment for all of us, isn't it? And particularly for universities and research at the moment. So the number of Department of Employment and Learning scholarships for PhDs become less. There's fewer being attributed to the university, and that makes it harder to get students to undertake that work. And actually this piece of work, I think, probably needs to be done by someone who's not a PhD student. It needs to be done by someone a little bit more credible, obviously, just to really make sure people listen to the outputs and they get done in a timely fashion.
Well, I hope the people are listening out there, because to me this is a very worthwhile piece of research in helping to address underachievement. But you did mention also that a lot of evidence is locked in the hospital file. Mm-hmm. And I think it was with specific reference to special education needs children. How can this be addressed, this particular issue?
I think the problem for clinicians who do a really good job doing the visual assessment of these children under a challenging situation, they need to be funded to have time to write reports. It's not a tradition in most healthcare services to provide reports for patients or parents of children who are being seen by those services. So you're trying to change the system, but you also, that there needs to be training, because they're difficult to write these reports. If you're trying to write a meaningful, jargon-free report and you haven't done that before, I believe me, I've done lots of them. It's challenging and it's a learning process. But you also need time to do it, and it does take a significant amount of time. So for one of the services that we ran in the Belfast area, for children with very complex neurological problems, we funded as much time for the report writing as we did for the assessment, and it took that much time to provide the report and the assessment. And where it was funded and where we were able to provide reports, we published research that showed that it was appreciated and used and understood. So it's an important thing to do, but it's changing a mindset, which we're working on, and I think there is some growing recognition in the services across the UK and Ireland that needs to happen. But it's also thinking about how are you going to cost that, because it does take time, and how do you train individuals. We've got some support materials on our web pages, our Ulster Vision resources pages, which allow clinicians to go in, and if they have a child with a vision, say they can see halfway down the chart, and we would call that 618. Doesn't really mean very much to anybody in the real world, but they can go and print off pictures and images that are of gross enough detail that someone with 618 vision should be easily able to see them at certain distances. And those kind of bits of information and developing that sort of information has been helpful for non-eye care professionals to understand what our eye care numbers mean. So it's a work in progress.
Thank you. Thank you. Thanks, Chair.
Thank you very much. Ms McLaughlin.
Thank you. And it's following on from Mr Rogers' point. There is the issue, because I picked up on what you said as well around information being locked in hospitals, and that's in itself a challenge. But the fact that there's no requirement to share, I think is a huge challenge with, between health and education.
There are some moves. I mean, even between eye care professionals, there isn't the tradition to share information, and that's just starting to change. But people are very reticent to share information because it takes time, and also they're putting things down in black and white, and that can be difficult for a child like Alex, as you saw. His visual situation is probably unfolding with his development, and what he sees one day might be a little bit different from what he sees another day when he's getting more seizures or when he's not feeling as well. So writing down in black and white how well he sees is a challenge, and you don't want someone to hold you to that and say you were wrong. So I think there's partly a nervousness amongst eye care professionals about raising expectations amongst parents by giving them information in black and white that then proves not to be the case, or by saying something that then is different and they're concerned that that's going to reflect badly on themselves. My feeling is that the parent has the right to that, and you can say at today's visit so-and-so's vision was, and it may be variable. There are ways of providing that information without being too black and white. You don't want to get parents' hopes up that there's vision when there isn't very good vision, or conversely that there's poor vision and then they prove to do really well in the future. So it is a challenge.
Yeah, but I think, Chair, if I may, there's a wider piece there that's important for us, I think, as legislators as well, in relation to the SEN bill going forward, and the opportunities to look at formal duty of cooperation
that would be great.
Between health and education.
I think the solicitor for the health board, I was speaking to Raymond Curran, who's the optometric lead for the health board, and we were talking about this information sharing even between eye care professionals, and he said information sharing should be the norm according to the solicitor. So they took some legal advice, but it's not required. So, and should be the norm doesn't make anybody do anything.
Okay, thank you.
So I appreciate your support on that.
Thank you.
It's important.
Thank you, Chair.
Can I thank you for your presentation this morning? I think members have found that really useful. And there's a number of things we want to follow up, and so we may be in contact with you again.
Perfect.
But we're happy to share
Thanks again.
information, so thank you very much for that.
Lovely to be.
Thank you very much.
Next time you'll have to come up and visit us.
So members content that we forward briefing paper to the department, just really seeking their comments really on the issues that have been raised, and also write to them just seeking an update really around an update on the, I suppose, the relevant aspects of the vision strategy.
Indeed, Chair.
And also funding for the regional vision resource base.
And follow on from Mr McLaughlin's point, I think there's no harm that the health know about this as well.
That's right. No,
I think we copy to both.
If you're content, then we copy it both to the Health Committee and also to the Department of Health.
Yeah.
Just sort of seek the same information.
And also, Chair, to write to DHS SBS about the Developing Eye Care Partnership Strategy,
yes.
Because what the committee might suggest then is that there be follow-up information provided post the P1 screening, as was suggested, just to say that there's a free optometrist test available.
Perhaps obviously within that correspondence maybe to health, it would be useful to draw attention to the role that the Public Health Agency can have with raising awareness for parents as well.
Of the multidisciplinary support team reviews.
Okay, so number of things we could do there. So members content we do that. Okay. Move then to correspondence, page 252 to 458. 17 items provided under correspondence plus 3 tabled items. Just draw your attention to a few of these. 9.2 of the Savings Delivery Plan 2013-14, it's the achievement report. Really, I suppose what we could do at this stage is note that, but maybe just sort of seek clarification around a comment which was made in relation to the entitlement framework savings. They say the saving has been secured through realignment of funding to those areas of greatest cost. If members are content, we just sort of seek clarification as to what they mean by that.
Agreed.
Agreed.
Agreed,
Okay,
yeah.
thank you. 9.3 with the non-teaching and teaching redundancy. It's page 255. If you're content that we maybe write to DE just seeking an update on the number of expressions of interest, and also an explanation around the term SEND posts, and really does that mean classroom assistants or does it mean something else? But also, if you're content really around the time scale for this, because we're getting to the stage where it's going to impact quite considerably on schools with regards to timetabling and their subject offer within those schools as well, dependent upon which teachers are going to be leaving post. So if you're content that we maybe just get some more information around that, just given the fact that we are now in April.
I think, Chair, the SEN bit is very important,
Yeah.
because I didn't notice in previous years, but that seemed to move to the top of the list in terms of priority, you know.
Okay, so if we can
Yeah.
get that information back in relation to that. Also, the careers review report recommendations, which have come from the Employment and Learning Committee. I think we need to go back to DE just to get some clarification on the way forward for the e-portfolio, and whether DE is going to require teachers to undertake careers CPD, and also for an update on its involvement in the work experience website, along with the career awareness sessions for parents. Really, the information that we've been getting back from the department around this was quite sketchy, wasn't it? And some of it was really dependent on costs.
Yes, Chair, so we're at page 269 of the correspondence. This is the, if you remember, the careers review undertaken by Brian Ambrose, briefed the committee about it in February, I think it was. So we've been getting various follow-ups from Employment and Learning and from DE, so they aren't saying exactly the same things. It sounded like, as the Chair just indicated, that DE was to take a decision on the e-portfolio in 2016-17, but there's other things that they were to be helping deal with, which the Chair has just said.
If we're content, then we just maybe get some more information just around those, just to make sure that, I suppose, DE is doing as it, I suppose, it's maybe committed to.
And I think, Chair, you make a valid point about the work experience in that as well, because, you know, it's that, again, relationship between departments, it's a relationship between the business world and about education. We've heard so much recently about our curriculum is not meeting the needs of an economy and whatever else. So I think your point, particularly about the place of work experience and the links between business and schools, all fits into this as well.
There was a website to be developed and launched in September. I suppose it's really to see what impact or what influence DE have had with regards to taking forward that work, what their involvement has been as well. But obviously the work experience aspect of this is really important. Okay, moving in 9.9 at page 313, we've response from SIA, and this was with regard to our queries around the acceptability of qualifications by universities and employers and the GCSE specification review. DE have indicated that although GCSE and A-level market remains open, DE will not approve GCSE English language, which does not include talking and listening, or science A-levels without a practical component. If you're content, we move right to SIA again, just seeking clarification around the review of GCSE qualifications, and also to see what the impact is going to be of the changes to GCSE A-level in relation to schools in Northern Ireland, including them whenever this, because we need to know when this takes effect and what impact this is going to have as to whether or not those schools can continue to offer those exams and so on. So I think it would be useful just to get some more information from the department, and also maybe write to the Minister just to get an update on the work of the GCSE A-level expert group, just to see where they are in relation to their work. If you're content that we do that.
Yeah.
9.13, page 336, we have primary school budgets. We've had similar correspondence from other schools with regards to this. If you're content, we forward this to the Minister just for his comments. And then we move to page 343. We've got St Ronan's College. A number of members met with concerned parents with regards to home to school transport. And this is the response, obviously, that we've received then from DE and from the Southern Region of the Education Authority. They've enclosed a copy of the development proposal for St Ronan's, and regarding the consultation, they refer to is referred to as a non-selective grammar in the consultation. However, page 351, advice to the Minister, also references a move away from the Dixon plan. At page 378, the SELB indicates non-eligible children cannot use board transport. I think we just need to get some clarification as to what that actually means. There is advice that's been given that they are going to talk to TransLink about the use of buses, but whether or not that's actually the school bus and whether they can pay a fare on that, or whether this is a different service. So I suppose if you're content that we seek more information around that, but also then forward what we've received to date to those parents who contacted us.
Yeah, just one wee thing in that. I think, I can't remember which one of the pages in it, but it talked about the time scale, and the quote was, it said, an early decision would clarify the position for interested parents before the end of this academic year. Yeah. And that was one of the major concerns of the parents. And, you know, this document here has been very helpful because it looks at the academic achievement and so on, and that was another major concern of the parents as well.
So are you content that we seek go back with further clarification around that? And then something which is of interest, obviously, to particularly around our own work programme. Page 389 is correspondence from the Minister around school starting age. He's indicating that it's unlikely that he's going to be able to proceed with legislation at this stage during this Assembly term with regards to school starting age. Obviously, this is disappointing, I suppose, once you've gone to consultation and there's an expectation has been given that legislation was likely to follow. But I suppose there is I no doubt members will be contacted by those who have been lobbying for this. But I suppose we do what we can do at this stage is to note it, but be disappointed at the fact that it's actually been left so late that we can't look towards a bill coming to us before the end of the term.
Indeed, Chair. Sorry, the committee will receive a briefing on school starting age on the consultation next week, and I believe Parents Out Loud are drafting something for us on the subject as well, so members might want to look at that again next week.
Okay. And also in tabled items, you'll also see that the Minister's indicated that the bill for GTCNI is not likely to be introduced in this term either. So. Okay. Are there any other items of correspondence that members have a concern around that I haven't maybe highlighted?
Just one little thing. It was 9.7. When I read that particular about autism. In the last paragraph of that page, it talked about all the services and so on and available. And just the thought just came to my mind is that when we, John is not here today, but when we met in the Autism APG, that the reality out there is much different, and parents feel very frustrated in terms of the lack of service and the lack of support.
I think, the recommendation would be that we would forward that to Pete for comment and ask them to maybe come back to us. With their thoughts on the correspondence.
Yeah.
Anything else? Any others? Issues that you want to raise? Okay, so if you're content, then we'll just deal with the correspondence as per the rest of it as per the cover sheet. Moving then to our draft forward work programme, there is a copy at page 460 to 462. I'll ask Peter maybe just to go through that with us? Just there are a number of changes.
Yes, Chair. So, yeah, position's a bit fluid now. So, we were hoping on the 29th of April that the department would come and talk about the inquiry. So, I will asking the department, perhaps ETI, try and persuade them to excuse me, to see if ETI could come along that day and maybe just talk about CRED. In terms of after the election then, the committee had planned to undertake an event on the 13th of May on levels of progression. You can see, actually, I've done a little paper on it. If you look at page 463 of your packs, members will be familiar with levels of progression. There's quite a bit of history. There's also been quite low levels of participation by the schools, but I think there had been some adverse feedback fairly recently, and that's why the committee wanted to do a further a piece of work, an informal stakeholder event. Just anecdotally, I understand that very few schools have undertaken levels of progression in 14-15. In fact, it's talking out of school here, but when we were in Maddie, I asked both principals and they didn't know anything about it. So the question then is, given the very low level of interest in this, do the committee still want to do the event? Or what we might do is just not use that slot, but later on before the summer recess, we might have to have an event on the Special Educational Needs and Disability Bill. Or if members do want to have the event, we might sort of broaden it to talk about value added and the dashboard of measures. So in members' hands on that one, Chair.
Well, might it be useful if maybe we did a little bit more work around it in advance and maybe just reschedule? Just to give more consideration as to what it is we want to actually get from the event.
Indeed, Chair. I think if we were going to have something on the 13th of May, I'd need the right out. So if you're content to consider it again then and say reschedule.
I think it would still be useful for us to do. I don't think we would want to shelve it entirely.
Yeah, I think the answer then maybe, Chair, is that for the department, the committee to contact SIA and just see what the feedback is like on levels of progression this time and what they've done with it. They've written to us just today about computer-based assessment. The numbers that I've quoted in my paper about the low participation, that came from SIA's annual report last year, so they will know what the level of uptake is like. It's just if I think what drove this was schools were contacting members. I don't know if that's still happening. But so in the meantime then, Chair, write SIA, see what the score is with levels of progression and go back to this.
Although I think the fact that we haven't heard from them may not be an indication that there may not still be a problem because they've probably been distracted by budgets and so on.
Indeed, indeed.
So, but I would still be keen to keep it on the agenda.
Sorry, Sean.
Well, it's not related. It's related to this. Keep going.
Okay, so other things then on the forward work programme. So my plan had been that we would have our final evidence session on the 29th of April for the inquiry. So that might turn into the 20th of May. And consequently, we'll have to see if Dr. Shuttleworth will come another day. And likewise, Cindy to talk about the SEND bill. But our plan still is to be in Sierra Special School on the 20th of May. If members are still on for that, because I know the Sierra are very keen for us to be there. And that additionally, the Assembly Legislative Trust have been on to me and offering an informal briefing session with Daniel Greenberg about the SEND bill. So Daniel Greenberg is a legal expert. If you've ever heard him talking, he's actually very entertaining and engaging. He would give a closed session for the committee on the SEND bill because it's not a very long bill, but the committee may wish to consider its tactics in terms of scrutinising that bill, because quite a lot of it is going to be in secondary legislation coming along later, and he will have some ideas about how to deal with that. And it is, honestly, he is very entertaining, it is very interesting. So if members are happy enough to do that, Devil.
Is it entertaining?
He is, yeah, he's very funny. He is really, really funny. He did a briefing up in room 115 just about legislation generally. It was a hoot. There were some members of the DUP, some of your party staff were there. They were laughing. So you asked him about it. He was very, very good. It was very funny.
Have to find out who that is.
So also, Chair, on the 27th of May, it's planned that we would have a briefing from the Primary Science Teaching Trust on the world around us. This is a UK-wide organisation. This will then inform member scrutiny of the ETI briefing on the world around us, which is scheduled for the 3rd of June. So finally then, the other thing was we had planned on the 10th of June to go to the Field Studies Council in Derrygonnelly, which is the other side of Enniskillen. Just bearing in mind, do you still want to do that, or might we reschedule that for another time, members, chair?
Well, it's the 10th. It's the 10th of June. So I suppose really what I'd ask members to do is to look at their diaries and then come back within the next 2 weeks just to confirm either way, so that we actually know and give the Field Studies Council sufficient notice whether or not we're planning to go or not.
Okay.
So, obviously.
Chuck, I just ask you, I spoke to them as well over a year ago, maybe 2 years ago. They were wanting to establish a facility closer to Belfast.
They have an office, I think.
Only an office?
They have an office in Belfast.
Right.
So this is an outdoor education.
Yeah, I know.
Titanic Quarter.
Yeah.
It'd be handy.
Okay.
So the
So
facility
members
became
content
an
then with the forward work programme?
Just one thing, was it on the forward, there was something about a review of the legislation with respect to homeschooling.
Yes.
Is it?
Sorry, members.
That was to come. We were to get an update on that today, but that's now been delayed until possibly May.
Yeah, the Education Authority contacted me on, I think it was Good Friday. I had emailed members about this. Yeah, they contacted me and said, no, we can't come. Can we come another time? This has been going on for a while, as the members are aware. But on the other hand, the Education Authority has just been established. They may be busy doing other things. What they suggested was that they come again in May as the chair is in.
That's okay.
Hasn't not gone but not forgotten.
It hasn't gone away.
Okay.
Where does it stand at the moment, that in the sequence of events? There was a consultation which is now closed, is that right?
Consultation's closed, and this is going to be feedback on the consultation.
Yeah.
They were looking for the committee's views, and they were going to set out their next steps for elective home education.
So we'll not see sight of that paper until sometime in May. Okay, so if members are content then to note then and agree changes then to the forward work programme. Okay, is there any other business? There's no other business. If members are content, the next committee meeting is scheduled to be next Wednesday, the 22nd of April at 10 a.m. in the Senate chamber. And if members are content, the committee is adjourned.
Well done, members. Thank you. Lots of stuff there. Lots of